Vice President and Regional Medical Director with WellSpan Medical Group with WellSpan Health. I am also a practicing family physician in the York area, so I see patients on a regular basis. I want to thank you for joining us for this Return to School webinar. Following the sessions today, we'll be sending out a link with the recording of today's featured topic, and we'll also include a short survey. We'd ask you to take a moment to complete that so we know how to continue to serve your needs best going forward. Tonight, I'm joined by Dr. Chris Russo, who's a practicing pediatrician. He is also one of our medical directors with the WellSpan Medical Group, and Dr. June Chan, who is the Vice President of Medical Affairs at Ephrata Community Hospital. So we value each of you and know that as administrators of our local schools, you're faced with challenging decisions that impact the lives of thousands within your district. We're so thankful for your dedication to serve our local community, and we want to thank you for taking time to join us today. We hope to help you navigate these uncertain times with as much insight that we can provide from our clinical experiences in responding to the COVID-19 pandemic. We're going to start by sharing updates on a few topics that we feel are most important, and then we'll answer some of your questions. Many of you submitted topics when you registered, so we'll try to answer those during a live Q&A when we're done with our comments. You can submit questions through the button featured on your screen at any time during the presentation, and we'll also try to tackle those as they come up. To start, both as a healthcare system and a provider of employee services, we want to share timely insights and learnings so your operations may consider policies and procedures to protect the health and safety of valued staff members and students. We have been tackling this problem now since the beginning of March, and we have had a lot of learnings. So as employers and residents, we turn to the Pennsylvania Department of Health and the Centers for Disease Control and Prevention as a source of truth for news, information, guidance, and mandates to ensure the safety of our families, friends, and the community. Like you, WellSpan looks to these organizations as the subject matter experts. We're grateful for their cooperation in advising our teams and our internal subject matter experts to help WellSpan align our policies and procedures with their guidance. I know there's a lot of questions and conflicting thoughts about how to keep students safe and what schools should be considering going forward as they look to reopen for the fall. The good news is that excellent guidance exists from the CDC, from our state officials, and we just need to leverage that. I do understand, though, that the local administrators are struggling with how to translate that into action plans for their school. First, it's important to continue implementing mitigation strategies until and even after there's a proven FDA vaccine. Students and staff screenings are a preemptive way of identifying potential COVID-19 positive cases. This can be as simple as reviewing a checklist of symptoms such as fever, cough, shortness of breath, and administering temperature checks prior to each day of school. The PA Department of Health has a symptom screening tool on their website, which makes this easy for parents, students, and teachers. There is no doubt that a COVID positive faculty member or student could cause significant service disruption in a school. We want to be ready for that. Beyond screening symptoms and staying home when feeling sick, the best preemptive measures are to reinforce social distancing in all circumstances and to make sure everyone is wearing masks. Operationally, you want to establish guidelines for on-site participation to ensure social distancing can be maintained. You'll need to redesign classrooms, common spaces to avoid crowding, stagger classroom transitions, and look at mitigating any unnecessary close contact with others. The size of your classroom and common areas may dictate the appropriate group maximums. And I know many of you have already done this, and this is great that you have, and we are here to help you with this. In addition, make known the expectations to wear a mask, cover coughs, wash your hands often, maintain social distancing, and sanitize workspaces. One thing that we have found is that people fatigue of these messages and we lax over time. It is really, really important to stay vigilant with these. Create ways to enforce these protocols and be especially clear in stressing the importance of staying home when sick. Be visible, post signage in high traffic areas that reinforce these messages. Now I want to discuss how to handle a symptomatic person. If a student or teacher is at school and develops one of these symptoms that are seen on the screen here, there is a simple flow chart from the Pennsylvania Department of Health and the Pennsylvania Department of Education that shows the process for how to handle this safely. We encourage the use of this. We can't stress enough the importance of symptomatic students and faculty being removed from close contact with others immediately, and to consult their primary care physician for assessment and care as necessary. So if you have someone with symptoms, don't have them come to school. Have them evaluated first. As is often the case when school starts, we're going to see a lot of common colds, coughs, sniffles, and they're all going to flare up. The key to remember is that we want to avoid unnecessary confusion and concern, and it is imperative that our communities trust their local medical professionals to diagnose illness and prescribe the proper guidance. We don't recommend, WellSpan does not recommend universal testing of symptomatic children for multiple reasons. One is due to the number of tests available nationwide and locally, which is very limited. The second is the importance of prioritizing those tests to those who have a clear medical need. And it's also the fact that children that have symptoms are not often sick with COVID. They are having other illnesses. For the same reasons, we are not recommending universal testing of asymptomatic patients who come in contact with a known COVID positive patient unless they in turn develop symptoms also. Neither WellSpan nor any other provider is likely to offer symptomatic testing due to the high demand and the constrained supply. If testing is deemed necessary by the primary care physician, we will advise our patients to follow the same guidance of quarantining until the test results are confirmed negative and symptoms improve. Students and teachers who test positive should remain home until 10 days since the onset of symptoms have passed. They are fever-free for at least 24 hours and their symptoms are improving. Very importantly, schools should refrain from requiring a negative test result to return to school in patients who were COVID positive. This includes adults such as teachers and students. These are not a requirement, nor are they recommended by the Department of Education or the CDC. WellSpan is following the CDC's symptom-based strategy guidelines for returning employees to work and students to school. The reason for this is that we are seeing positive test results for persons who have been asymptomatic for over 6 weeks and are no longer contagious. So this is not only an ineffective way to determine fitness to return, but it puts significant strain on our testing system and wait times for results. Once again, we would stress, if you have someone that is COVID positive, please do not require a negative test to return to work or to return to school. Now let's define what constitutes a close contact. As provided by the CDC, a close contact means a person within 6 feet of a COVID positive person for at least 15 minutes. Obviously, anyone with a close encounter should monitor for symptoms and stay home and stay away from others if they are present. This also means that working to keep students and faculty more than 6 feet apart during classes, meals, and other group settings lasting longer than 15 minutes is vital to mitigating the spread of the virus. Before I turn it over, I want to express gratitude to our community for their commitment to keeping our schools safe and working diligently to do the right thing despite the challenges presented. As physicians, we're always here to help. In our follow-up email, you'll get information on how to contact WellSpan as you navigate the ongoing landscape of the COVID-19 pandemic. Again, I want to thank you for all that you're doing to support our friends and neighbors and for joining us today. So I'm now going to turn it over to Dr. Chris Russo. Chris, I'll turn it over to you.
Great, thank you, Dr. Godecker. Again, my name is Dr. Christopher Russo, and I am board certified in pediatrics, and I'm the director of pediatrics for WellSpan Health, and I see children primarily at WellSpan York Hospital. As a practicing pediatrician, I have seen the effects of the pandemic on young people firsthand. It's my hope that this evening we can help give you insight into what we've learned thus far and to help arm you with information that can help you make the very best decisions for your students, their families, your faculty, and staff. Before we begin, I just want to say one thing. I am the son of two public school teachers in Boston. My father taught high school chemistry in Boston for many years, and my mother was an elementary school principal. I know full well the sacrifices that you make and also your families make on behalf of the children in the community. So thank you for your service, and know that even though it isn't often recognized, you are very much appreciated by us. Now, our community has done a really remarkable job over the past few months to pull together and to really ensure that those who need care in their community can continue to access it. Now, I want a word about screening, just to echo what Dr. Godecker mentioned. Children are more likely than adults to be asymptomatic or to have only mild symptoms. And many of the symptoms, as Dr. Godecker mentioned, are also common in other childhood illnesses, like the common cold or flu or seasonal allergies. And there's no symptom or set of symptoms that only occurs in children diagnosed with COVID-19. Now, a word about fevers as well. A fever in a child is generally defined as 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. Measured temperature is the preferred and most accurate measure to determine a fever, although we do understand that some parents and caregivers may not have that option available to them. And a subjective fever or the child feeling warm may also be used in those situations. Now, we know infectious diseases are spread through contact, and if you can remove the contact, well, then you can perhaps mitigate the chance of contracting the disease. And this is the basis for recommending mask wearing. But we also know that this is not always comfortable, and for some in the community, there may be a legitimate concern or condition that would make wearing a mask prohibitive. These circumstances are not always easy to understand, and they might be of a nature that a young person might not feel comfortable disclosing their situation to anyone other than their primary care physician. We are working to provide the very best service to our patients as possible, and would ask that you try to create a process for students to submit their mask exemption requests discreetly, trusting that the medical care providers, after having examined the circumstance, will decide whether it warrants an exemption or not. And this would hopefully avoid any unnecessary discomfort for the child. And we think it's important that you communicate this policy clearly in the district to avoid any confusion and to provide more comfort to those who may be fearful about being the target of any angst due to this condition. Knowing that this is likely to come up, having plans in place to ensure these students can be accommodated with seating in classes that avoids any close encounters, something Dr. Godecker mentioned, will be crucial. And it's important to note for your students and staff that they need to be respectful and understanding of others who may require these accommodations. As far as masks, cloth masks are preferred. Place the cloth mask covering securely over your nose and mouth and stretch it from ear to ear. It should fit snugly, but comfortably against the sides of the face and be held on with ear loops or ties. And children should be reminded to wash their hands before and after wearing the mask and avoid touching it once it's on. And parents should be encouraged to wash and completely dry any cloth face coverings after each wearing. And although it may be obvious to us, it may not be to children, that masks should not be worn when eating or drinking. And also make sure that the face covering has no choking or strangulation hazards for young children. Now, regarding care, we've heard from patients experiencing serious medical issues aside from COVID-19, including behavioral health concerns, that they are choosing not to come to the hospital or to their primary care offices for care over fear that they may contract COVID within the building. This fear, paired with many children going to virtual learning and a lot of school systems not requiring standard immunizations or back-to-school checkups, and athletic schedules being changed as well, removing the standard physicals that are required, this is a cause for concern among practitioners for the general health of children. You should know that because of rigorous safety measures that WellSpan has put in place, that our primary care offices and hospitals remain safe places to seek care for both routine and emergency conditions. And about emergency conditions, it's essential that this not be delayed. Call 911, go to the nearest emergency department if anyone has a life-threatening condition. And please make sure that you communicate this to all your faculty, staff, students, and parents. This really could save a life. In addition, please advise your students to get their routine checkups, immunizations, and physicals, even if you are transitioning to virtual learning. This will be vital to maintaining our healthy communities. And last, on a personal note, I just want to mention that schools really should anticipate and be prepared to address the wide range of mental health needs for students and staff. The COVID pandemic has affected everyone, and most notably children and particularly adolescents. This would include providing mental health support for any parent, any student struggling with stress from the pandemic, or recognizing students that may have heightened anxiety or distress. And of course, being very aware that students may present with suicidal thoughts or behavior, and how can you get them the right support that they need. So please keep your health and safety at top of mind, and know that we at WellSpan are here to provide you with the very best and safest care. Now I would like to turn it over to Dr. Chong.
Thank you, Dr. Russo. Again, I want to echo the exact same sentiment of thank you. And I actually want to share a text that I exchanged with one of the local superintendent this afternoon. That district actually they reopened it today. So her quotes, "The kids were super cooperative and so willing to do whatever we asked. They have a new appreciation for school, some panic from the staff, but being with the kids really warmed their hearts. I could see the staff relax as the day progressed. Our parents did so well with prepping the kids, and the teachers helped make it all feel normal again." So being with the kids, being there with the purpose of educating our kids, obviously is what warmed our teachers and took a lot of that anxiety of, boy, am I going to be infected with the COVID-19 sort of out the window. Just like when we actually had no contact with our patients during COVID-19, when we actually started seeing our patients in our offices, we felt the purpose again. So I hate to denigrate your profession with that of physicians, but we are kind of cut out of the same mold. So thank you. So let me conclude our guidance before we actually answer some questions. It's important to mention that how your county and city may impact your plans may vary from one district to another. Not all areas have this health department. Like Bucks County in Philadelphia area has one, but York and Lancaster does not. We've also seen different funding distribution to the counties in our area from federal, state, and even at local levels, with different ways of spending these funds to support the local pandemic response. Because of these nuances, we recommend using caution when you compare yours versus next door neighbor district. In some cases, you may be able to support contact tracing effort based on grant, like in Lancaster County, or consult local information that could be helpful in determining your school's policies on how to resume learning again. we would recommend that engaging with your local representatives and healthcare professionals like us to get informations and regulatory guidelines that may help guide your decisions. Additionally, each district has a different resources too, which factor into your ability to execute various plan elements. We've seen that no plan is applicable in all cases, and that there can be multiple ways to be right or to provide safety. Most importantly, that you want to establish clear communication of your safety policies. Train your staff to know your response plans in every situation, and that you ensure them that you have the plan to ensure the safety of your students, staff, and their families. A popular topic beyond safety in the classroom is athletic. WellSpan sports medicine team has worked closely with many districts to establish reopening of athletic plans for safely conducting training sessions, practices, and competitive events, as well as a plan on how to handle COVID-positive participants. These documents are available upon request by emailing wsportsmedicine@wellspan.org. You can also call our sports medicine hotline that is staffed 24/7 with any questions at 877-482-5420. We'll include that information in the chat for everyone. Lastly, I want to actually repeat what Dr. Godecker said earlier. We'll be sending out a link with the recording of today's session, and you'll get to hear my funky joke again. And you'll also receive a short survey. So please take a moment to complete that so that we know how to continue serving your needs and the community's needs the best. So thank you, everyone. Here's Mr. Gunderson.
All right, thank you, Dr. Chan. For those that have questions, there should be a Q&A button on your screen. Once you open that, you can type in your question and I'll relay them to our doctors. But we'll start with some that have been submitted in advance. The first being probably best to you, Dr. Godecker. Can you update us on availability of tests and turnaround times for results, including your expectations of how that may be affected moving forward?
So as many people know, testing has been in the news quite a bit. We have had a significant shortfall of testing for multiple reasons in the United States. I think the biggest one is really trying to allocate the testing where it is needed the most and really having a good testing strategy. One of the things that we've been able to do at WellSpan is that we've been able to increase our internal testing capacity. Right now, we are using it for our inpatients so that are admitted to our 8 acute hospitals across the region. And we are also using it for our employees that are symptomatic with the thought that we are trying to figure out who has COVID and should not be working. We have also been working with a partner called Quest, which is a nationwide lab organization, and they have been doing a lot of our other testing. So if such as our patients that come to our practices that have symptoms, or any of our other type of testing that we need to do, such as before procedures, if patients are having surgery, elective surgery such as that. About 3 weeks ago or so, the turnaround time for those tests that we were sending out to Quest were up to 14 days. And as you can imagine, a test result showing up 14 days later had very little clinical usefulness. The main reason that got so long was that Quest was so overwhelmed with tests from all the different states, especially such as Texas, Arizona, Florida, where they were having surges, that they just couldn't keep up with capacity. Over the past week and a half or so, they've significantly improved that. They have their turnaround time for testing is now back down to about 2 to 4 days, some patients less. which has been great, and it's really been allowed us to provide the care that we need to patients. I think the word of caution I would have about testing, and having been involved a lot in these discussions, is that we have to make sure that we are responsible stewards with the testing. There are times where testing is absolutely indicated, but there are other times where we should stay away from it. An example would be the universities that were requiring negative tests for all the students returning to campus. It told you that they were negative that day, but it didn't tell you anything about the next day or any subsequent days. And so all that did was increase the number of tests that needed to be run and overwhelm the system, but it really did not help from an epidemiologic standpoint. What my ask would be for everybody on the call is that if you have any questions about testing or whether testing should be appropriate, to please reach out to us. That is something that we can definitely help and try to make sure that we are testing the people that should be tested and not testing those that should not be tested.
Okay, great. Thank you, Dr. Godecker. And I think we only have one more pre-submitted. So again, if you have questions, go ahead and type those into the Q&A box. The next question is, can you tell us more about the COVID-19 hotline and what that may be for and when it's available?
Yeah, so when this goes way back to measles, we had 2 measles cases within WellSpan back in last September. And what we learned very quickly is that the public had a lot of questions when it came to the measles. And what we learned was that we could stand up a toll-free line and answer questions that people might have. What was interesting about that is that we were getting calls from people all over the country with that. So when COVID started, one of the first things that we did was we reestablished this call line to answer questions. And I'll provide the phone number and we'll send this out, but it's 855-851-3641. That's 855-851-3641. And what this number is, it's staffed by nurses. We staff it Monday through Friday from 8 to 5 p.m. These nurses are there to answer questions for patients, employers, schools, whoever might have a question regarding COVID-19. They have a physician that is backing them up at all times. So if they cannot answer the question, they can reach out to this physician and then they can provide a follow-up answer. So it's been very helpful trying to get information out to the community. And I would definitely encourage those at the schools or in your departments to use this. You can definitely share this with our school nurses or athletic trainers, anyone that might need guidance. This is clinical guidance that is free and available to help with management.
Okay, great. And a lot of the questions that were pre-submitted were about testing. So I think you covered that. And we covered the mask wearing, which was another question we fielded. So unless we get another question here in the next minute or so, we'll go ahead and conclude today's session. So if you have a last minute question, go ahead and type that in now. We'll wait here about a minute, and otherwise we'll go ahead and conclude. Okay, I'm not seeing anything. Any final thoughts? Anything you think you may have missed?
Reed, I just want to emphasize how important it is that we remain open with open lines of communications between us and the schools. One of our values, our core values, is that we are a trusted partner with the agencies and the schools and the people in our communities, and we really want to be that trusted partner. So if you have questions, if you have anything that we can help you with or guidance that you need, this is not easy stuff, and we know that, and there are going to be challenges that you will face in the next few days. Please reach out to us. I am a parent. I have a seventh grader and a freshman in high school that just started today. I want them to be able to attend school in person. I want to make sure that the schools remain open. So the important thing is that we want to do all of these things correctly, and we want to help provide you that guidance. So please feel free to reach out to us, and we are here to help.
Terrific. Well, thank you guys for your time, and thanks to all who attended. And with that, we will go ahead and wrap up. There will be a follow-up email with these resources, contact information, and some other stuff for you there, and a survey to fill out so that we know how we can help you guys moving forward. So thanks again, and have a great evening.
All right. Thank you, everybody.
Thank you, everyone.